My name is Bob Safran. I'm the chair of the Department of Social and Cultural Analysis here at SFA. And it's my pleasure to introduce to you this afternoon Miss Kathleen Kennedy Townsend. She is visiting campus as the Woodrow Wilson Visiting Fellow, as part of the Woodrow Wilson Visiting Fellow program, which brings together academic audiences like ourselves and public figures like Miss Townsend. Ms. Townsend has been Lieutenant Governor of Maryland from 1995 to 2003. She is on the board of the John F. Kennedy Library. She is a visiting fellow at Harvard's Kennedy School of Government. She has written a book called Failing America's Faithful, How Today's Churches Are Mixing God with Politics and Losing Their Way. She's the daughter of Robert and Ethel Kennedy. And her topic of discussion this afternoon is social policy. Ms. Townsend, let me introduce to you who you're speaking to.
Perfect.
We've got 3 classes here. We've got a class on aging and social problems.
Could you raise your hand if you're doing aging?
And
4 of you.
And the teacher is J.B. Watson.
Thank you.
Then we have a class in early childhood, and the teacher is Kay McIninch. Raise your hand.
Oh.
And we have a class on U.S. history since 1877, so since Reconstruction, and the instructor is Court Carney.
Nice.
With that,
Thank you. Great.
the floor is yours.
Hey, thank you so much.
Oh, you're welcome.
Well, I'm really pleased to be with you. And I saw that very few were doing the aging. There are more of us who are aging, so I'd appreciate if some more of you would get involved with aging. Anyway, I'm very happy. Do you guys want to sit down? You too. Okay. So I think there are sort of a couple of ways we could do this, since you're really doing 3 very different topics. 1, you could ask me questions. 2, I could list a group of things that I could talk about, and we could vote about what you're most interested in. And 3, and which is what I want to start off with. First of all, do any of you have any questions for me? No. I'm supposed to entertain you, right? So what I'd love, I know that some of you are involved in public policy or interest in public policy, the elderly, the people working in aging and the people working in, with the young. And those who are interested in history must have views about public policy. So I'd like to get a sense from you, if you could change anything in public policy, what would you do?
Regulations on like state-run nursing homes.
Really? That's an interesting one. Regulation, I have no idea what you want to be done to change it. What would you want to be done to change it?
Maybe the standards.
How should they be changed?
The requirements of the people working in the nursing homes.
What about them?
I think they need to be higher.
Higher standards.
Higher standards.
Would you pay them more?
Maybe so. I think you'd have to, right?
Well, it's up to you. It's your policy. So you want higher standards and better pay for those who work in nursing homes. That's a really great idea. Absolutely terrific idea. Okay, both of you. Great.
We're just gonna, because we're in the same class and we're learning about aging, and like the few of us are gerontology minors and stuff. So I guess we realize that the population is aging.
Yes.
Like, and more people
that's
are
what
aging.
I was saying. Me.
Yeah. Well, like longevity is increasing, and
Right.
so we have an aging, I guess, issue, and I feel like we need more nursing care and better nursing care than there is now. I think it should be more of a priority, I guess, rather than.
Great.
like,
So
back.
you two have a really interesting dialogue going, which we're going to spread out. Okay, thank you. Anybody? And does anybody have any other views? Yes.
I'm not too sure if this falls along what we're speaking of, but education in general, being able to start kindergarten at a certain age. because I believe I was affected by this as well as some other people that I know of, not being able to start kindergarten because of their age and their birthday, being born one day past the cutoff day, and that's I think that's ridiculous.
Yeah. Well, you could say, like in the state of Maryland, we have pre-kindergarten. So you don't have, if you miss kindergarten, you can go to pre-kindergarten. So I think in education in general, one would be, how much pre-K opportunities are there in the state of Texas? Some states have a lot, like Maryland. We spend a lot on 0 to 3, and I don't know, I think Texas doesn't. Am I correct?
Yes.
Okay, so you could change Texas policy. That would be interesting. Okay, anything else? Yes?
I have a question. What exactly is Obamacare?
What is Obamacare? Such a great question. Obamacare, in brief, says that everybody should have health care. And either you're going to get it through your employer, or if you don't get it through your employer, you can get it through an exchange program that is set up by your state. And if your state doesn't want to set it up, the federal government will set it up. So it gives you an opportunity to get health care. For instance, you may not know this, but people who didn't used to get health care would be somebody, for instance, if they had been sick once in their life. They might be called, like if they had multiple sclerosis when they were growing up, or cancer, or some sort of disease. They could, for the rest of their life, they couldn't get health care unless they worked for a large employer in which everybody could get health care. Did you know that? So large numbers, so let me just explain. Large numbers of Americans could not get health care because of what is called a pre-existing condition. Insurance companies would turn them down and said, we don't want to insure you. So Obamacare has said everybody should get insurance. That's one of the biggest changes, is that everybody will get insurance. And before, they could be turned down.
What if you can't afford insurance?
Then the government pays for you. Like most European countries, everybody has a health insurance. And because everybody has health insurance, I'll give you an example. I'll give you 2 examples from right in your own community, okay? Should we put Obamacare down? What is Obamacare? That's an excellent question. Let me just ask, are there any other questions besides that? I think everybody, okay, I'm going to ask you something. Do you have a piece of paper and a pencil? I want everybody to take 2 minutes while I'm talking about Obamacare to put down something they want to have changed. I want you, even if you don't really want it, pretend. Just I want you to get into the custom of thinking how things can be improved. So, and I don't know any of your handwriting, but I want, in about 10 minutes, I'm going to go read through what you guys say, okay? Well, and if somebody doesn't have a piece of paper, what do you think you should do? Ah, what a great idea. So this young man, what is your name?
Jared.
Jared doesn't have a piece of paper or a pencil, so can somebody share that with Jared? You can write, you only have to, my thing is to only say one thing, but if you want to write 2 or 10 or 25, you're right. But I want everybody to at least say one thing, okay? Now, while you're doing that, does everybody have a piece of paper and a pencil? This is going to be fun. It'll be great. And Molly is going to have some help, because could somebody volunteer after they write something down to help Molly read all these things, and she's going to, you two will choose which ones you want to talk about. Be kind of interesting. Molly needs, who wants to help Molly? Do you want to help Molly? Okay, you got to go up with her. What is your name? Zoe. Zoe and Molly are going to help. If any guy wants to volunteer, I think that we should also have a guy. Okay. So, Zoe asked about Obamacare, right? So the other thing is that what happened is, one, if you had a pre-existing condition, you couldn't get health care. Two, if you pretend you were in a car accident, right? And you went to the hospital and you didn't have health care, what would the hospital do?
Turn you away.
No, they weren't allowed to turn you away. If you had an emergency, if you were bleeding, if there was blood, you couldn't turn you away. So the hospital would have to take care of you, right? So who paid for that taking care of you? She paid for you. Because she had health care and you didn't, so her health care covered you, right?
Yes.
That's actually the truth. I don't know if you had health care, but in other words, the people who had health care took care of the people who didn't at the emergency room. So is that right? Maybe it is right, but the point is, in Obamacare, everybody goes to the emergency room, and therefore everybody has health care, and your health care dollars don't have to go up in order to pay for her at the emergency room, okay? So that's interesting. Did you all know that? I know the adults knew this. Okay, so that's another change. Do you like that idea? Do you understand that people were paying for your high health care costs when you were sick, but you weren't paying for it? Somebody had to pay for it. So now it's spread. The other thing that would happen is that if you didn't have health care in the old system, a couple things would happen. One, you would get sick and sick and sick, and you wouldn't go to the doctor because you couldn't afford the doctor, and then you get even sicker. And two things could happen. You would end up in the emergency room anyway, because you were so sick. Or you started coughing and you spread the flu. Or you spread HIV and AIDS. Or you spread other diseases because you weren't taking care of yourself. So you made the whole community sick, which wasn't good either. Anybody have any reaction to what I'm saying? Yes?
Why are people so against it? Everything you're saying, it sounds like such a positive thing that we want our country to have, but why?
Why were people against it? Okay, I'll tell you a really interesting story. This is so interesting. So, as you probably have heard, there are conservatives and liberals. Have you heard about that? I just didn't know in Texas if you've ever heard of the word liberal. It's kind of a joke. So about 25 years ago, what liberals wanted, I'll tell you what liberals used to want. They wanted something called the Canadian system, or the system that is in much of Europe, which is that we pay taxes, there's one supplier, and health care costs half what it does in the United States, and they get better outcomes. Everybody has health care, people live longer, there's fewer child mortality. Doesn't that sound great? I wanted a resounding yes. Yes. Thank you. Okay, but that was told way too liberal. Socialism, government paying, doing everything. That's a terrible idea. So that didn't go over very well. So the conservatives, under the Heritage Foundation, which I know you guys have probably never heard of, but it's a conservative think tank, said, well, we do need health care. That's at the point when at least some conservatives thought we should have health care for everybody. And they said we should have something called an individual mandate, where everybody has to get health care, and you have to pay for it, unless you're too poor to pay for it. But otherwise, you have to pay for it. So Obama put this, so Mitt Romney in Massachusetts put this individual mandate in the Massachusetts plan that had health care for all, and it meant that everybody in Massachusetts, for the first and only state in the country, had health care. And he said, that's the responsible thing to do, because it's responsible to pay for your health care. Okay? That's what Mitt Romney, who is Mitt Romney? I just want to know how much you guys are paying attention to politics. He was the governor of Massachusetts, and he was also the Republican candidate. Republicans then decided, because Obama liked this, they were going to be against it. And so they became, how dare the government tell me that I have to buy health care? They have no right to tell me that I have to buy health care. It was a Republican idea. And then they just didn't like it because Obama liked it. Sometimes, you know, when you have somebody you don't like, I mean, I'm sure you like all your classmates, but it's possible that sometimes you don't like somebody. Does that ring a bell? Yes. I mean, come on, you guys. You don't like everybody. I mean, you know you're supposed to, but you don't. And sometimes, because they say something, you just go, shh. And that's what happened. I mean, that's the easiest way to explain it. The bigger and the more difficult way to explain it is healthcare has lots, healthcare in the United States is like 20% of our GDP, or GDP. And so that means if you're an insurance company, you have an interest. If you're a hospital, you have an interest. If you're a doctor, you have an interest. If you're a nursing home care, you have an interest. So everybody, if you're a, what are they called, drug company, you have an interest. If you are a prosthetic company, you have an interest. So you have all these. I'm telling you, nobody's paid any attention to me whatsoever. I can tell from your faces that you think that's really boring. But because of that, okay, so why don't you look at them and you figure out what you think is going to be interesting for this group. Okay. All right, so does anybody have any other questions about health care? Yes.
How is this going to affect, will it affect the people, the aging? Will it affect the the health care from Medicare, Medicaid?
Excellent question. That's a really good question. So I'm going to give you another story, okay? Which I think is really... Does anybody really want to hear that answer? I mean, are you a student? Okay. So, about most of our health care dollars, do you know how most of our health care dollars are spent? Let's have a guess. Where do the federal health care, you pay, not you yet, but your parents pay taxes. Where do most of our health care dollars go to?
Medicaid.
Come on, you guys, think. I shout. I mean, I'm getting old, remember? So I can't hear everything. So tell me, where do you think they go to?
Social Security.
No. Okay. No. Social Security that's an interesting answer. Social Security is spent is a check to you, and you can spend it on your housing or your food. I'm talking about, where are your health care dollars? Where do the federal health care dollars go to? What are they spent mostly on? Medicare. Medicare is health care for the elderly. And when do the elderly use most of that health care? Last 3 months of life. So that's a really important statistic. I'm going to give you two really important statistics which aren't quite accurate, but they're close enough. Most of your health care dollars are spent on the last 3 months of your life, and most health care dollars in the United States, not just Medicare dollars, are spent, a third is spent on, do you know what they're spent on? Obesity-related diseases. Obesity-related diseases. So what does that say about what we should do as a country? Hello? Very well said. Exactly. We should stop eating so much, and we should do some more exercise. And in fact, I was just talking to your professor, where is he? There you are, and saying you're trying to come up with a core curriculum, and you should include exercise as part of your core curriculum, right? I mean, if a third of our, we're going bankrupt because people don't exercise, get people to exercise, okay? Yes?
I'm a kines major, and that's...
You're what?
A kinesiology major.
Yeah.
And that's what they drill in our heads is prevention, exercise, and healthy lifestyle choices.
Exactly. Thank you
So,
very much.
I agree with you. I think that that's one of the main things that is wrong with our country and
Great.
what needs to change.
Well, can I just say, I've been in this classroom for 25 minutes and nobody said they agreed with me yet, so I want to thank you for that. Excellent. That's very good. So that's really what she said today. The other thing you can think about is why, and this goes to the first question, we spent so much money on the last 3 months of life. Do we really need to spend that much money on the last 3 months of life? And why do we do that? And does that make sense for us? And part of the reason we do it is because the way we do medicine in the United States and the way that has to be changed is we spend money, a doctor gets paid for every test that he asks for. Did you know that? How do doctors get paid? You should always, there's a famous thing from the Watergate, which was before your time, follow the money. How do people get paid? They don't get paid on whether somebody gets well. They get paid on how many tests they ask for. So if you want a new boat, or a new house, or better tuition for your child, what do you do? More tests. Exactly. I mean, that may not be consciously the case, but unconsciously. So there are lots of studies now in the United States about how do you get people to be healthy, and it's not by doing lots of tests. And so there's going to have to be a shift in how health care is reimbursed, not through the tests, but by getting people healthy. And that would be a much more effective way to do it, and you'd save a lot of money if you did it that way, which we need to do, because otherwise we're just going to go bankrupt ourselves by testing all these people that don't really do any good. Anybody have any comments on this?
I don't understand why they would pay per test.
Because they don't pay. The insurance companies pay. And that's why it happens. And you poor thing. I'm so sorry. Do you want some water? I would like some water. And because the doctors, I mean, people lobby to get that because they like to be paid for the tests. Okay, I'm being a little lefty. Just to warn you, some people might not agree with everything I've just said, but I thought I'd be a little controversial because it's more interesting, right? Otherwise, it's kind of boring. Okay. Does anybody have anything else to ask about healthcare? Yes?
Wouldn't, like making healthcare available to everyone, wouldn't that kind of lead to overuse of it? Like,
Absolutely. Well, it's not over. We already have overuse by the population that's already insured, right? So they're already insured. So that overuse is a different question. What you want, don't you want everybody to have health care? Because you don't want to have to pay for somebody to go to the hospital that's not you, right? Exactly. So that's a really good question. So how do you prevent overuse?
I don't see it.
Well, you do in Europe. Their healthcare costs in Europe are less than half the cost in the United States, and they have better results. They have healthier people with half the cost. Did you know that? Did anybody know that? You knew that. 2 people. How many? Could you raise your hands? How many people knew that? Good. So the reason they do it is they don't pay per test, which is what we do in the United States. They pay for it's called the whole system. They don't have as many lobbyists as we do. So that if I produce a pill, and you just read this about Amgen, which is a company, and in the last bill that was supposed to be taking care of the victims of Sandy, Amgen lobbied to get a $500 million boost to their company by changing the Medicare laws. And by saying that you couldn't use generic drugs, you had to use their drug. That's not about healthcare for all. That's just healthcare. That's just helping a particular company. So there's a different question about overuse versus covering everybody. You can cover everybody because they do it in Europe all the time, and they don't have overuse. In fact, they use half the services. It's actually really an interesting problem. Has a lot to do with how much money is spent in lobbying. Yes? Anyway, that's just, I don't know if I'm being clear. Do you think I'm being clear? I guess you wouldn't tell me because you have to be nice to me that I'm being totally confusing. Okay. Yes?
What about healthcare when it comes to or illegal immigrants or people with visas or not American citizens? How does healthcare?
It usually depends on what the state decides. So the federal government does not require you to cover illegal immigrants, but Texas, I'm sure, does. I don't actually know what Texas does, but Maryland does require that illegal immigrants be covered by health care, because you don't want, if you have whooping cough and you're walking down the street, I want you to get rid of your whooping cough, right? Because otherwise you're going to give it to me. So I want as much good health as I possibly can, otherwise these illegal immigrants are going to make me sick. That's called public health. So some states require it, like Maryland, and some states don't, and I don't know it depends on your own state policy. I don't know what Texas is. But Texas is one of the most progressive states in the country on terms of allowing illegal immigrants to go to college, and you know that. So congratulations to you. No, it's great, because, anyway. Okay, is this the list?
Yes.
Can we thank Molly and Zoe for doing a great job? I mean, they're really cool. They volunteered and they're great. So tell us what you found from the questions.
Well, we divided everything into separate piles of what seemed relevant to each other, and we have, six? We have six that we thought everybody wanted to talk about. Should businesses provide insurance to their employees? Stricter immigration laws, women's rights, being pro-choice, equal payment, gun laws, education budget, a lot of this. Social Security, no more two-party system, less federal government.
Okay, great. All right, so now what we're going to do, we have 15 minutes, we're going to take a vote. And we're going to vote on, everybody can vote. You can vote as many times as you want on which ones you want to discuss, and we'll discuss them in order, okay? So why don't you, how about businesses provide insurance? What kind of insurance? Life insurance? Health insurance. Okay. I think we've talked a lot about health insurance already. But if you want to keep talking about it, we'll do it. Okay, how many want to do that one?
No one.
Boy, did I discourage you. That was really inappropriate of me. I'm sorry. We'll put it down at the end. That was really, I'm not supposed to do that. Okay. Stricter immigration laws. Who wants to talk about that? We have to put the number next to it so we can remember, or at least so I can see. 12. Okay. Women's rights. Gun laws. Great. Education budget. Whoa. Do we see a little self-interest here? This is really smart, because you know what? This is politics. You choose what affects you the most. That's so great. Social Security, no two-party system, less federal government. Who wants to discuss that? That's really unpopular. Okay, 6 people. Okay, we're gonna 7. Okay, well, guess what we're gonna start with? All right, you guys. Let's think about the education budget. Are you talking about K through 12 or higher education? So, what do you want to raise the what do you want when you said education funding? Do you want lower tuition for college? How many want that? Okay. So, now I'll give you what they do in Europe. This is a great question. What do they do in Europe? Free college. In Denmark, where my daughter went for a semester abroad, they paid them kids to go to college. They paid for their food, and they paid for their housing. What do you think of that?
I think it's great.
That's heaven.
So the question, but what do they do in order to do that? They have high taxes. And are Denmarks happy? Denmarkians? What? Danish. I think they're called Danish. Yeah. The Danish, who have like a really high tax rate, are the happiest people in the world. And it's really weird. It's so cold there, and they're still happy. They also drink the most of any people in the world. So you have so the country, I'll just give you, this is my argument. You have a choice. Do you want to be a country, and they have a much better economy than the United States. I mean, it's full employment, they're doing really well, they have a high standard of living, they have good health care. I mean, they got a lot going for them. Most of them have second homes. I mean, it's like a really good deal. And why is because they say, we're all in this together. It's important that everybody gets educated. And because we know that that in an information-based economy, the more that we have an educated workforce, the better we're going to do. So we have a responsibility, or we just think it's a great idea, that everybody gets educated. And we're going to pay taxes for that because we know that it's going to be rebound to our benefit. And so that's why they do it. Now, we used to believe that in the United States. Did you know that? If you learn your American history, when I was growing up, for instance, as you know, and I'm sure you've heard of the Kennedy family, right? You heard that they were well off. Did you hear that? Yes. That they had money, right? Did you hear that? So do you know what our tax rate was when I was growing up? Can somebody guess what our tax rate was? 27%. Okay, that's one guess, 27%. What's another guess? 2%. You guys, I was 2%. No. Any other guesses?
30.
Remember what I was trying to say? At one point, this country said that we're all in this together. We should help one another. So, what was the tax rate? What was the tax rate if we all are in this together? 35%. That's what Obama wants to do now. What did it used to be? Was it higher or lower than it was to now? Higher, right. So what was it? 50. Keep going.
75.
No. Who said 90? You're right. It was 90%. That's what we paid, 90%. Why did we pay this? Because we thought America was one country and that we wanted everybody to do well. Not just the few, not just the lucky, not just the fortunate who are lucky enough to be born into a wealthy family or smart enough to invent Google. Okay, like, good for them. Or, I'm really happy for them. But no, that doesn't mean everybody gets to invent Google or Apple or one of them. In fact, they were invented by immigrants. If you heard my speech last night, 8 of the 10 biggest companies, newest biggest companies in the United States were formed by immigrants. If you believe you're one country, then you pay taxes because you want everybody to do well. That's what we used to believe, till that was changed. So, in order to get a really good education budget, you have to change the culture of the country that says everybody should have a chance, not just the few. And that's not our culture right now. Obama's working hard to get it that way, but he has a few problems, like the Republicans. Okay. Okay, so we've done that. Anybody have anything else to say about the education budget? Yes?
What about the idea of education inflation? How does that play into, like, say, Denmark, where everybody's college educated since it's free to them? How do they avoid education inflation?
I don't know. I don't know everything. But, you know, I mean, obviously, it's not one of the biggest issues. It's just not, nobody, I mean, I was there for a week and a half. Nobody talked about education inflation. Not an issue. It was. I mean, they don't get paid as much. The teachers don't get, actually, the professors in Denmark are much more respected than professors in the United States, because professors in Europe are considered much more better. Clearly, I need a little grammar education, which I'm sure you could teach me. Okay, so that was, anybody else want to talk about education? Yes?
I guess what bothers me the most is like where the budget is spent within education. Like, not necessarily as a country, but like a lot of places spend a lot of money on like sports and not necessarily on academics.
Oh, really?
I mean,
no, you're right.
Spending most of their money on academics, but
yeah, I think you're right. And my instinct about that, I don't think they spend tax dollars on sports. I mean, is that right? They usually, I could be wrong. That's not true in the high school level, but at the college level, sports is a great way to get alumni to give money.
Here we just passed, it was last semester.
Did it
they
pass?
just passed an act where they're going to put a new student fee in your tuition, and you're going to start paying an athletics fee to the department. It was voted on by the students and it passed. Okay. So,
$5 to each credit hour that you enrolled in.
and
So they would take that.
And they would do it. They would send it to your. You have the best gym. What?
It's sort of like the football stadium, the policy, and the athletics.
Well, if you guys vote for it, I can't help it. I mean, that's. Okay, let's move on because we only have 5 more minutes. So, education budget. Anything else? I thought you raised a good question, but like if your fellow students want to do it, I mean, you could educate them. Good luck. Okay, next, 17, women's rights. Good for you. Well, this is my sense about women's rights. The 21st century, I'm sorry guys, is going to be the century for women. It's just happening. And actually what I think the biggest challenge is not women's rights as we go forward, but what the role of men. If you look at colleges now, and I can see, I don't know if this is typical at SFA, but mostly across the United States, 60% of the students enrolled in colleges are women. And that's true in Europe, it's true in Iran, it's true in India, and basically what is happening is men are dropping out. And why are they dropping out? Because they are not as good. No, I wouldn't say that. That would be a really obnoxious thing to say. But small motor skills are good. Women are good at, and they're just the skills that are needed in the 21st century. The skills that women are good at, and they're going to take over. So you're going to have. I mean, we're not equal now in terms of people my age to men, but college-educated women, for instance, in New York City make more money than guys do. And it's just the tip of the iceberg. So really, I am happy that women are doing well, and I think it's going to be great, but I really think the big challenge in the next 20 years is what are we going to do with the guys? Okay, any comments on that? What? Physical labor. No, I mean, if you look at that, I'll just give you an example. In the African American community, we have, which was a community in which in the 40s and 50s, many of the men worked. They had worked in large factories. They were in union members, and they produced, or they worked on farms. And then when those jobs disappeared and we passed these draconian drug laws, we now have more African American men in prison than we do at going to college. And if you look at what's going on in many cities across the United States, we have large numbers of single mothers in the African American community, as the men are not producing, and they're not getting the jobs. And I think it's a very disturbing and difficult situation. So I think it's a very, very, very tough situation. So I think one of the biggest issues that we're going to face going forward is how we're going to make men feel that they have a role. Because I think it's better that everybody feels important, not just one gender. How's that for an answer that you didn't expect? Who knew? Okay, gun laws, yeah. I mean, do I think that we should have gun laws that make sense? Yes. Do we need assault weapons? No. Why do we need to kill lots of people? Do we need to register? 60% of guns are not, you don't do a background check. We should do a background check and see if we're selling them to a felon. In Maryland, when I was lieutenant governor, we changed the laws so that people who beat up their families couldn't get a gun. Because we didn't think it was right that if you're going to commit family violence, you should beat up your wife or beat up your children, you shouldn't have a gun. Or some women beat up their husbands, they shouldn't get a gun either. And the other thing that I tried to do when we passed, and then I think the NRA, when I rescinded it, with every gun, you know, it's like a fingerprint. There's a special marking. And so we wanted to make sure that every gun was registered so we'd see what the marking was, shoot every gun, and so that we would know every time we found a bullet where that gun came, where it came from. Doesn't that make sense? Be easy to find out who shot, at least which gun shot the bullet. And the NRA was against it. So why do I think the NRA is against it? I think there are two reasons. One, they get a lot of money from gun manufacturers. Remember, I said the same thing about Medicare, healthcare. There's a lot of money in this, and money influences policy. And two, there's this, I mean, if you grow up and your father or some mothers, you know, teaches you how to use a gun, you feel it's part of your culture and you're excited, and it upsets you. And you feel like somebody who doesn't understand your culture is trying to take the gun away from you. I don't know if this is true in Texas, but in Pennsylvania, which is just north of Maryland where I live, the first day of hunting is a day off from school. You know, it's part of the culture. And so this is a very difficult thing, because if you grow up in a hunting culture, you see guns in one way. If you grew up in Baltimore City, which is where I'm near, and we have 350 killings a year, you feel it differently. So it's going to be a continual dialogue.
Kathleen, you asked me to be the enforcer. 3:15.
You guys, thank you so much. Good luck. I hope you all become great advocates for the change that you know is needed in this country. Thank you very, very much.